Welcome back, and as we earlier said, we're going to be talking about the presidential initiative, the most successful, the most targeting health initiative that targeted the health of all Egyptian women, regardless of their ages, their brackets, whatever. This initiative is targeting the well-being of mothers, the well-being of Egyptian teenagers, females, and all Egyptian females in every governorate, and also targeting the women in most in Africa at the same time. That is also initiated by President Abdel Fattah al-Sisi. And we have more details in the following report.
The Ministry of Health and Population said that up to 49.886 million women have received medical services provided by the Egyptian Women's Health Presidential Initiative since its launch in July 2019 until the end of May 2024. In a statement, Health Ministry spokesman Hussam Abdel Ghaffar said the total number of visits made by female beneficiaries of the presidential initiative is classified to the following: 21.783 million visits for the first time, 16.881 million regular visits, and 11.221 million single visits. The spokesman called on women to regularly check on their health condition through utilizing services provided by the Sustainable Initiative. Abdel Ghaffar said as many as 637,474 women have undergone advanced examination as part of the initiative that provides free of charge medical services through 3,663 health units distributed across the country. The Ministry of Health and Population announced in a statement Egypt's Mother and Fetus Health Initiative, part of the 100 Million Healthy Lives Presidential Initiative, has screened a total of 2.39 million women since its launch until now. The ministry announced that the initiative had screened 1.8 million women since its launch, meaning that nearly 590,000 women have been screened in 10 months. Launched in March 2020, the initiative diagnoses diseases transmitted from mothers to fetuses at an early stage and provides free treatment and medical care.
Welcome back, and on that very important topic, we're very delighted to be having with us our prominent guest, Dr. Islam Anan. He's professor of Economics and Epidemiology, and also he's a lecturer of health policy and health economics. Good morning, Dr. Anan.
Good morning. It's always a pleasure to be on the morning show.
Our real pleasure, Dr. Anan. Of course, when we talk about the health initiatives that were taken by President Abdel Fattah al-Sisi targeting women's health at large, at every corner of Egypt, we talk about too many successes, too many fronts, and sub-initiatives also, not only a specific health initiative. If you like to elaborate.
That's a very good point to start with that, talking about the main initiative aim. And since the launch, as you mentioned, of the presidential initiatives for health in 2018, the main purpose was actually two things. First is to prevent, and second is to early detect diseases. To prevent, we mean that we put some measures and some standard public health initiatives to prevent diseases from emergence. Something like, for example, fighting obesity during adolescence and childhood to prevent the emergence of non-communicable diseases like diabetes and hypertension and so on. The other aspect, early detection, which is, for example, like the early detection of breast cancer, early detection of psychiatric diseases, so we can detect it in early stages and treat it in the most efficient way from clinical perspective, where we can actually catch the patient in an early stage with a curable stage, rather than to find and be presented in a later metastatic, for example, or in a deteriorating state of health. We will be able to save the human being. So if we can put it in a nutshell, President Abdel Fattah al-Sisi, during the launch, he mentioned that our main aim is health, not fighting disease or treating disease. It's promoting health and providing the Egyptian citizen with better health to be able to be a productive person, and finally to be able to reach our SDGs and vision of 2030 of having a citizen who's healthy, being productive, and can be giving the community with his family whatever the aspects of prosperous and happiness that we can provide.
Right. When we talk about women health initiatives that were planned for at the early beginnings when they just first started, we can also sense that those initiatives are going to target also another other health initiatives that are targeting children, because women are source of society, and if women is supposed to maintain a good health, that means that also this is going to result in the good health of their siblings and their kids and the whole family. So talk to us about the other initiatives also targeting children.
So if we can take the presidential initiatives, which are actually 14 currently, it changes all the life cycle of the Egyptian citizen. Starting, as you mentioned, even from birth, by the way, till senior citizen step. So we are talking about mother and fetus presidential initiative, which is a very interesting presidential initiative targeting pregnant women, that they can actually follow up. So we are talking not just about children, we're talking even before that, to follow up their pregnancy level. It's also free in any primary care unit, and they can do all the virology testing. They give them advices about how to manage their pregnancy, their health during that. And also, this one will bridge to another presidential initiative, which is the 1,000 Golden Days. With the first 1,000 of any child is actually the most important phase because it shapes all his life. So we target mothers to educate and make more awareness about, for example, breastfeeding and how it's very important that they do breastfeeding and not just to depend on artificial feeding or ready-to-feed milk, for example, and how this affects the child's health and affects the mother's health as well, because current and recent studies, for example, demonstrated that breastfeeding decreases the incidence of breast cancer. And then after the 1,000 days, which is, we are talking about the first 3 years of the child's days, we are talking about the child during the school age. And for that, as you mentioned, we are targeting as well to fight the prevention of a disease, which is anemia, obesity, and stunting, which is short stature. How can we advise mothers and even teachers in schools on how to make sure that they are taking nutritious meals, they are taking their school meals, and we educate mothers about the nutrients content of any meal for the school children. And this campaign particularly, they screen every year 10 million school-age children. Year after year, we noticed in 2018 till last year that we do have a significant drop in the incidence of anemia, the incidence of stunting, which is short stature, and we are trying, and this is the most hard one, the obesity one. It's decreasing year after year, but not with a significant figure, and this is very alarming, and year after year we are focusing in communication that we do have overweight children, we do have overweight school children, and we need to make sure that mothers, they are give nutritious and healthy foods instead of that junk and fast food, which is the easy way just to make their children, after school, just eat any junk food, eat any fast food they can then in a fast way study and then sleep. We need to fight this one with better education. And then, as you mentioned exactly, after school age, we need some more presidential initiatives talking about the non-communicable diseases, which is the later stage. And by that, we screen and diabetes, hypertension, and dyslipidemia, which are actually the first cause of death, unfortunately, in Egypt. We do have around 15 million citizens living with diabetes, for example, around 20 million citizens living with hypertension, So we need to prevent the cause and to early detect these three diseases rather than just having the patient presented in a later stage. After that, and by the way, in this initiative we screen around 10 million every year. So far we screen 20 million Egyptians for the three non-communicable diseases. And a lot of programs have been made to make sure that we do have better communication for diabetic patients. Again, same thing, it adds to eating healthy foods, having more exercise, doing so more physical activity, and so on. And if the patient needs systemic treatment, then another stage. This is not a prevention initiative. The prevention initiative often they refer them the best place to take their treatment, whether we are talking on a state fund, for example, or we are talking about the health insurance organization coverage. All that will lead to a lot of other initiatives, like you mentioned in the first question about the breast cancer. The breast cancer initiative, and this is one of the Guinness Records initiatives in terms of number of screening. We are talking about 46 million visits done by Egyptian women, 46 million, almost 50 million visits. And why this is very significant, because it showed that Egyptian women, they do care about their health, they're responding to the campaign very efficiently, and by that we detected thousands of breast cancer cases, and this is very important in early stages. And this is very important because in breast cancer, when you detect cases in early stage, you can just cure it. We are having, again, a 100% healthy woman. They can be productive to their family. They can give again to economy about the production and having a productive woman. And the most important thing, we do have a healthy Egyptian woman. And this is the main aim about the breast cancer initiative, which is from early detection till whether surgery or the full treatment of cure without staged breast cancer by almost 20%, which is a very significant figure.
Right. Also, is there a certain disease or a certain diagnosis, or let me put it in another way, are there any health programs that could be set for women in order to maintain the health of their children? I mean, are there any diseases that are relevant when the woman is diagnosed with a certain disease? It could be transferred to their kids or to their infants or their toddlers at an early age. So explain to us if there could be some programs, some awareness, health awareness, some very effective means to be able to be transferred amongst Egyptian women in the form of an awareness campaign to be able to prevent the transmitted disease between the mother and their children.
Yes. For that as well, because what you mentioned, it falls under the early detection and prevention campaigns. We do have two actually campaigns for that. The first one is to detect any virus that can be transmitted during pregnancy. And for that, in the Mother and Fetus Prevention Initiative, we screen pregnant women for hepatitis C and hepatitis B, as well as syphilis and HIV, which is AIDS. And this is a very important campaign because these viruses can be easily transferable to the fetus, and then it leads to unhealthy child since birth, and they're gonna suffer all their childhood. They can be treated, of course, but it will be a very long process of treatment. Another one, which is a very important prevention initiative, is the genetic diseases. And for that, we're not talking about screening a pregnant woman to see how can we cure, but rather we're trying to take it from the start, from the premarital state. So currently, and by Egyptian new laws, any new couple planning to get married, they need to do initial extra tests than before. They're doing genetic testing. So for example, they can be carriers to a certain genetic disease. Of course, no one can prevent a marriage, but we advise the couples that be aware that both of you are carrying a genetic disease, and if you get married, you will end up having a sick baby, end up having a baby with genetic disease. and we are talking serious diseases. We are talking something like hemophilia, thalassemia, and so on, and sickle cell anemia, of course. So one advice after another advice, a counseling, even a psychiatric counseling to the couple to tell them that be aware about that. And by that, the prevention should detect 19 genetic diseases and they inform the parents about it. If not, and they got married, there is another one, which is once they give birth to their child, Egypt currently they screen 2 million old babies in ICU or newborns coming to the ICU regarding all the 19 genetic diseases. You have 2 million births every year, and around 150 to 200,000 they enter the ICU, which is the ICU for neonates, and all of them are actually screened every year for the 19 diseases. And if detected, they are giving the early treatment for free. Again, when you're early detected since birth, you will be able easily to manage and to treat. Otherwise, some of these diseases will end up, unfortunately, by death if they are not detected. So this is what the prevention is actually doing for pregnant mothers to prevent transferability, as you mentioned, to the fetus, as well as the early detection of the fetus for the genetic diseases.
Right. How long have been this particular idea of women health initiatives been going on, and does every year has a special target?
Again, that's a very good point. It started in 2018 and it will go till 2032, most probably. And the year 2032 is very significant because this will be the year where the new health insurance will be actually implemented all over nationwide, the place. It should cover all governorates. And when the new health insurance covers all governorates, the prevention initiatives or the health initiatives of public health should be implemented and embedded inside the health insurance. So the prevention initiatives are currently, we can call it a bridge between the old insurance system and the new. We are preparing all Egyptians, we are detecting and preventing diseases. So when the health insurance, the new one, is implemented, they're going to be covering a more healthy Egyptian. And the plan that the health insurance should be actually covering all Egyptians by 2032. And it triggered a lot of other initiatives, as you mentioned, for women. So for example, last year, another prevention initiative was launched for women health, which is the early detection of cervical cancer and the prevention of cervical cancer. Because this is a cancer that we can prevent using a vaccine. Most of the cervical cancer cases are happening after an infection with human papillomavirus, the HPV virus, which can be easily preventable by vaccine. So two things are actually happening right now. The first one is to early detect cervical cancer by a swab. And here we're talking about diagnostics as well, how diagnostics can help in that, and how public-private partnership can help, because Egypt to the most significant Swiss company who can actually work on diagnostics. A very good offer, which is, we can say, around 80% of the value that's currently in Europe be available in Egypt with the same technology to early detect it. And the cervical cancer, usually we need a swab from the adolescents. We're talking about from 12 to 18 years old girls, usually at school. And if so, we can easily detect it in early stage, and if so, we can easily cure. This is for early detection. For completely blocking the incidence of cervical cancer, and this is a very good way to announce it now, that we should be vaccinating all our adolescents and our youth, our girls from 12 to 18 with cervical cancer vaccine, which is human papillomavirus vaccine. This is very effective. The incidence of it is actually higher than a lot of other countries, so it's better to have the vaccine. And it will trigger a lot of other prevention initiatives, by the way. One of the most recent ones, which was actually launched last month, is the Presidential Initiative for Psychological and Health and Wellness, which is targeting depression and anxiety and a lot of other factors. But I will focus on pregnant mothers and depression following labor. This will be as well included because we do have instances of a higher percentage of depression after labor with pregnant after delivery. So 3 sessions are made. They can easily call the hotline and register a session, and this will be a free of charge. It's just launched last month, and it again will go hand in hand with other 14 presidential initiatives.
Right. On that note, of course, Dr. Islam Anan, Professor of Pharmacoeconomics and Epidemiology and also lecturer of health policy and health economics, would like to thank you so much talking to us on The Breakfast Show, and you have a very good day. We're going to go to a short break and we'll come to continue the show, so stay with us.